Hi, hot dogs. Welcome to the Town Hall in November, and I'm excited today to be right across the street from Frankfort High School at the Meridian Health Services Annex, and happy to have with me today Lisa Suttle. Lisa is the Vice President of Clinical Services from Meridian Health, and I have next to me Allyson Ward, and Allyson is the Director of Nursing Services. And so today is going to be a showcase of Meridian and how Meridian is impacting and can impact the students and staff in Frankfort, Community Schools of Frankfort, as well as the whole county. So welcome, ladies. Great to have you today. Thanks for joining. Could you just, I introduced your names, but Lisa, could you just tell a little bit more about what you do for Meridian Health?
Sure. My name is Lisa Suttle. I'm a Regional Vice President for Clinical Services and mainly for behavioral health. I am a nurse by background, have a master's in business. I do a lot at Meridian, not because I'm made to, but just because I like to.
Yes.
I like to be involved and be included in things that are happening throughout the area and increase our services, for the population specifically that's underserved in many ways. So we really try to help them. And I'm a huge advocate of mental health, have been for several years. So anything that we can do in that regards to help with mental health services. So that's a big part of what I do at Meridian.
All right, thank you. Allyson, how about you?
All right. So I have been with Meridian 2 years as of today, actually. I am the Director of Nursing Services. I have direct oversight of all of our school-based health clinics. I am a big advocate for our school-based health clinics. We have a lot of community needs within the schools, and just trying to keep the kids in school is very, very important. So I'm really excited about our services here.
All right, thank you. We're covering both of our bases, from behavioral health to the nursing services, and sure appreciate everything and just the great potential Meridian has to impact our community. So thank you. Lisa, I have a kind of three-part question for you. The first part, share with the viewers the purpose of a school-based health clinic.
Okay, so kind of in a nutshell, what a school-based health clinic does is brings primary care, behavioral health, and sometimes dental care to services, to communities specifically. The clinic is for anyone that wants to use it. It's not just for the underserved. It's not just for the wealthy in the area. It's for anybody that wants to use our services. We hire the same nurse practitioners, psychiatrists, physicians that we would for any of our other locations. And we provide that service within a school or a clinic within a community. We come into the communities as a partner, as a visitor, not coming in to take it all over, because we do our research before of making sure that the service will be sustained by the volumes of patients that we would see in that area. And it really is to help from a federal funded level, that we can help people that don't have insurance, don't have jobs, have low income, and that can, get more on board with preventative care rather than the reactive care of something occurring. So, and the school-based health clinics, we staff just like we do, any of our other locations, are open offices or anything like that. But the school-based has really just helped us to put a clinic inside of a school, be very accessible, be not just about a clinic, but be a partner, like I said, in the schools to provide education, to provide crisis services if something happens in the school, to just be available and to be flexible too. All of our schools are so different in the areas that we provide school-based health centers, like this one, of having an annex and the clinic in the school. We don't have that at all of our locations.
And where else are you guys? Do you also have clinics around the state?
I have my list because
Okay.
I didn't want to leave anything
All right.
out, and
Yeah,
the
great.
list has grown.
All right.
So we are in Wayne County in
Okay.
Richmond schools. We're in Anderson in Madison County. We're in Muncie. Muncie was our first location that
Okay.
we went into a school. We're in Union City up in Randolph Eastern County in that area. We're coming into Western,
Okay.
Cheville,
Yep.
and of course Frankfort, Modoc schools. I think I got everybody. Yes.
And Lisa, how do you guys, I mean, we feel blessed that you chose community schools of Frankfort and came into Clinton County. How do you select the school districts to know, you mentioned that you do your homework beforehand, so how do you select the districts to know where to approach a district and ask if you'd want to be partners with this?
Many times it's word of mouth. Somebody says to us, hey, I've heard about your service. Have you checked into this school? And in this regards, it was an employee of ours, Tiffany, who let us know, hey, this might be a school that we'd be interested in. So from there, then, we do our homework to take a look at it. You know, what is the population within the communities? What's the needs? What other services are already being provided? Again, we don't come in to step on others' toes. We come in to help. And all of these areas that we have the clinics in, there is plenty to go around,
yes.
plenty of need to go around.
Yes.
So we're not coming in to take over in any regards. It's a choice that people make whether they want to come to us or not. So we just are available and hopeful that people will take on the health care that we provide or can provide to them.
Thank you, Lisa.
Yes.
Allyson, what services are offered here at the health clinic at the annex as well as within the high school?
Okay, so it's pretty similar. We can do anything from sports physicals, well child visits. We can do well visits for adults as well. We're actually in the process of working on getting a VFC, which is actually vaccine for children. It's a state-funded program that we can provide vaccines to people who are underinsured, Medicaid, or just don't have insurance at all, which is great. We also have private stock vaccines as well, so that people who have commercial insurance can still get those, which is great to help with immunization compliance in the schools, because that's been a huge issue since COVID. But yeah, we do those, and then we do the sports physicals. They're $10 for students, which is great too.
Yes. I know you guys did that in August, and I know the athletic directors at both schools are very appreciative of that. What type of staff are here in this annex office as well as in the clinic at the high school? Okay.
We have a nurse practitioner who sees both children and adults. We also have medical assistants. We have a skill builder who can also help with some behavioral health needs, and we're working on hiring a therapist as well.
Okay, thank you. At this time, let's take a break for Eric Farley's Frankfort Fun Facts, and we will be back after the Fun Facts to talk more to Lisa and Allyson about Meridian Health Services.
Thank you, Dr. Rhoda, and welcome back to another episode of Farley's Frankfort Fun Facts. Today, I'd like to highlight an important service for our community, Meridian Health Services. Meridian Health Services offers health care for not just our students and staff at the community schools of Frankfort, but also everyone throughout the community and beyond. Did you know they take walk-in appointments as well as regular appointments, and they accept all forms of insurance? Meridian Health Services is currently housed at 50 South Wabash Street. This used to be our administration center here for the community schools of Frankfort. It used to house our superintendent, his administrative assistant, as well as our school board meetings prior to 2011. This is when the new Education Administration Center, located at 2400 East Wabash Street, was constructed. It now not only houses our superintendent and his administrative assistant, but also our assistant superintendent and our various directors. That's it for Farley's Frankfort Fun Facts. Have a great day, hot dogs.
Thank you, Eric. Hope you enjoyed Eric Farley's Frankfort Fun Facts. I'm back with Lisa Suttle and Allyson Ward from Meridian Health Services to learn a little bit more on this part of the segment, a little bit more about how our community can access the health clinic. Lisa, can you share a little bit about what it means to be a federally qualified health clinic?
Sure. We have several FQHCs, I'll call them, throughout the state. And what that helps to bring to the community, and also for us too as well, is funding that supports an area that maybe is underserved in regards to medical, dental, and behavioral health services. And it brings a higher level of service too as well. So the funding supports a psychiatrist, a physician, nurse practitioner, licensed staff. So it really helps us in that regard. It helps us to sustain that level because it can be very expensive.
Yes.
There's a lot of competition out there
Yes.
to hire people.
That's right.
So that is one of the things that it does. But on the other hand, for the patient specifically, if someone's going through a rough time, they don't have a lot of income coming in, but they have medical needs, there's a sliding scale that we follow. So many times with all of the schools that we're associated with, patients' families do not pay anything, or they may pay a $10 co-charge. If people struggle with paying, we can help them with that too as well. If they don't have insurance, we can help to get them signed up for insurance too. It just is kind of a one-stop for many things that can occur to help with health care.
We have a community, and so you've kind of shared that whether you have insurance, you have very little, not very good, or none whatsoever, you can access the clinic. We have a huge population of multilingual community here, and so if somebody comes into the health clinic and can only speak Spanish, and I know that's not a question how can you help that family navigate the services here at the health clinic?
We have an electronic system, a telephonic system that we use at all of our locations, and we test it every once in a while just to make sure we're meeting the need of the patients, and we always get really good feedback that it's working. So that's here too.
Oh, great, thank you. Allyson, can you tell our hot dog viewers and our whole Clinton County, how does one access Meridian Health Services from students, from staff in community schools of Frankfort, and for the whole community, because it's not just for Frankfort schools?
Sure. So we are actually seeing the high school students at the high school clinic, and then we're also seeing staff members of the school system at the high school as well. Now, let's say our staff are over here in the building, we're definitely going to, let them come over here and we will see them here as well. All the students from, the middle schools and the elementaries we've been seeing here in the annex, and then also the community members we see in the annex as well. So they're welcome to call and we will get them scheduled.
Okay. Where can so you've kind of shared where that is. Is there a phone number and address for this? Obviously, the high school is the address for our high school kids, but as far as the community wanting to access this, what is the address here other than across the street from the high school?
50 South Mash Road.
50 South Mash Road.
Yep.
Very good. Very impressed. All right, thank you. How does and again, maybe just repeat, how does the community access it? Because maybe somebody's saying that they don't go to Frankfort schools, and they are maybe they're either Clinton Central, Clinton Prairie, Rossville, or maybe they're not associated with schools at all. Can anyone from Clinton County come here?
Come here to the annex,
Okay,
yes.
come here to the annex. Thank you. Okay. Lisa, what is your vision for the services here at Meridian, and kind of what it can do for the community schools of Frankfort and then the community as a whole? What do you kind of want to see when we're successful here? What will that look like?
Sure. I want to add one thing about the FQHC real quickly.
Yes.
It makes us perform at a higher level too, I would say. We have surveyors that come and check on us. We have to request approval to be able to provide the service here. So in another part of that, I just wanted to share that too as well. And we appreciate it because it keeps us on our toes and doing what we need to be doing.
All right.
Our vision across the board with Meridian is about that holistic model and treating patients. It's very important when we're assessing a patient specifically for mental health or primary care needs that we're assessing everything that's going on with them, because it's nowadays it's really hard that somebody with something medical doesn't have something else going on with anxiety, depression, those kind of things. So we want to take care of all of those things at the same time. Or at least offer it to people. So that's a big part of our vision. But also when we come into the communities, like I've said before, we're visitors to start. We become partners after that, after people begin to trust us.
Very much so.
And we don't want people to think we're coming in to push or anything like that. We're a service that's available. We want to be accessible. We want it to be a can-do. It's not, no, we're not going to help you. It's, okay, maybe we can't do all of that, but this is what
Yeah.
we can do.
Yeah.
We also want to be flexible. I was just talking with Muncie Schools on our way here this morning, and we've been there for 4 years, and it's time for us to review. Is this all working well? Do we need to expand it to another school within the system? So those are all things that we do as well, and just making sure that we're available for the schools and whatever need is there, and change what's needed.
Well, I have, from my point of view, as I've been working with you to get this implemented in community schools of Frankfort and our school board, we've all worked together. I have felt like it has been a collaborative process, and when we have had things that we needed to troubleshoot to figure out how to help make it better. You guys are always right here at the table to make it better, because we want your vision, same as ours. We want to support our community. I want to support community schools of Frankfort kids and staff, and this is also going to impact the whole community. So I can't thank you enough for choosing Clinton County to come to and community schools of Frankfort to partner with us. And I think it's a blessing that we have this partnership, and I can't wait to see it grow. And I think it will, as people become more knowledgeable about that you're here and what you can do. And regardless of whether you have insurance or not, you can come. And sometimes a misnomer is that, well, we don't want our kids to go to Meridian if they go to the health nurse. And there's a process for that. Nobody can come to Meridian without having parent approval for that. So we've got a lot of those safeguards in place. We just want to be able to take care of kids and staff and the community for behavioral health needs and medical needs if needed. So I can't thank you guys enough, and Meridian for coming in and investing in our community and investing in this place too, the old central office. So thank you for that. All right, Hot Dog Nation, thank you for tuning in to November Town Hall. And next up, I'm at the high school with Roaming with Rhoda. So enjoy Roaming with Rhoda. Thank you. Welcome to the November Roaming with Rhoda. This month, I'm going to be asking Frankfort High School students what makes them smile. We're in the month of Thanksgiving. We give thanks for a lot of things, but I want to find out what brings kids at high school level joy. So we're going to ask them today what makes them smile. Enjoy this episode. All right, you were on Roaming with Rhoda. What is your name?
Gabby.
Gabby. And Gabby, what makes you smile?
My family.
Your family. Thank you, Gabby. What is your name?
Geraldine.
Geraldine. And what makes you smile?
Anything. Like right now.
Like right now, this makes you smile. All right, great. Okay, what is your name?
Denise.
Denise.
Yes.
And Denise, you're on Roaming with Rhoda. What makes you smile?
The teachers.
The teachers make you
Yes.
smile.
Yes.
Knowing that other people can smile and have a good day.
Oh, all right. Love it. Thank you. You're on Roaming with Rhoda, Miss Tillman. What makes you smile?
My students' understanding.
All right. Thank you very much. What is your name?
Juliana.
Juliana. What makes you smile, Juliana?
My friends.
Natalia?
Yes.
And Natalia, what makes you smile?
Being nervous.
Being nervous. Okay. What is your name?
Mrs. Johnson.
Mrs. Johnson, what makes you smile?
Hard-working students make me smile.
All right. Love it. Thank you. What is your name?
Macy.
Macy. Macy, what makes you smile?
My friends.
Your friends do. Thank you. What's your name?
Alfredo Ronaldo Soto Villa.
Alfredo. What makes you smile?
My parents.
Your parents do. Thank you, Alfredo. Appreciate it. Ramon, you're on Roaming with Rhoda. What makes you smile?
My family.
Your family. All right, thank you. What is your name?
Nevaeh Johnson.
Nevaeh. What makes you smile?
A lot of things, actually. One of them being anime.
Anime. Thank you. Ashley, what makes you smile?
I would say probably like friends or something.
Your friends do. Okay. What is your name?
Giselle.
Giselle. What makes you smile?
The same thing she said, like friends and being around good people.
Yuretsi, what makes you smile?
Drawing.
What's this?
Hey, don't run into the hallway.
What's this
Walk
guy?
down. How you doing?
What's this guy?
Dr. Rhoda.
Hey, Coach Art, how you doing?
Christmas coming up, and I have the best Christmas gift present I could ever give anybody, which is an autographed picture of me.
Okay.
Fortunately, I left it on my desk. I'm sorry about that.
All
But
right.
Just stop by, say how you doing, say hi to the kids.
While you're here, what makes you smile, Coach Art?
Well, I think the fact that I get to teach school safety to kids and to the staff,
All
and
right.
to yourself, and seeing you every day. That's why you have an autographed picture of me.
All right.
So I have to go. I have headbands.
All
and
right,
watch.
thanks.
So I'll talk to you later.
David, what makes you smile?
My cat.
Your cat makes you smile. What makes you smile, Mr. Clayton?
Our new basketball coach, Jake Nerney.
All right.
We like him.
All
yeah.
right, love it, Mr.
Yeah,
Clayton. Thank you. Edwin, what makes you smile?
I don't know, it's just my friends.
Just your friends do. Okay, are these your friends right here? Hey guys, what's your name?
It's Jonathan.
Jonathan, what's your name?
Leo.
Hey, what makes you guys smile?
The people.
People, what makes you smile?
Family?
Family, love it, thank you. What's your name?
Jim Skinner.
Jim Skinner. Mr. Skinner, what makes you smile?
Just been here around our students.
All right, I thought you were going to say White Sox, so
Well, that's not a smiling thing this year.
okay, all right,
Yeah.
thanks, Mr. Skinner.
All right.
Uriel is your name. What makes you smile?
My family.
Your family, all right.
Rachel.
Your name is Rachel, and Rachel, what makes you smile?
I would say music.
Your music makes you smile. Thank you. All right, there you have it, hot dogs. We talked to a few students here at Frankfort High School about what makes them smile. Had everything from family, friends, and some people just caught off guard, but it made them smile. So have a great day, hot dogs.